Hello, my name is Jennifer Santiago and I'm a student here at Houston Christian University. First and foremost, I just wanted to do the introduction. Secondly, I wanted to give a little brief overview of what I'm going to be discussing in this video. I'm going to be talking about the video in our course for week 6 titled Needs and Challenges of Disaster. So as the video suggests, we are going to be talking about the needs and challenges that come along with disasters. More specifically, there are emotional phases that have been recognized to come along with disasters that are common in communities and groups. Some of these include what happens before a disaster, during, and the ones that we are going to be talking about happen post-disaster. And these are going to be the heroic phase, the honeymoon phase, the disillusionment phase, and the reconstruction phase. So what is the heroic phase? One definition states characterized by a high level of activity with a low level of productivity. There is a sense of altruism and community members exhibit an adrenaline-induced rescue behavior. This phase often passes quickly. So what does this mean? The heroic phase happens immediately after a disaster. There is a level of productivity, there's the level of keeping busy and trying to maintain and trying to resolve a problem that is very here and now. The reason that this phase does not last very long is because focusing on the here and the now and overworking yourself in order to try to rebuild does not leave enough room for a person to recognize their emotional losses, their familial losses. And very quickly do those things come to surface and you burn out, and which I will be discussing when we move over to the honeymoon phase. But when it comes to needs and challenges for the heroic phase, needs emotional support from colleagues and community. There is a moment where all of these traumatic events, no matter the phase, brings people together. There is a connectedness. Adequate resources and supplies. Being prepared for these kinds of situations really helps in the moment when you are trying to rebuild. As well as recognition for their hard work. People putting in the time, working 7 days a week, helping their neighbor, need to feel appreciated and recognized for the work that they are doing. Challenges. Physical and mental fatigue from constant demands. You are overworking yourself during this phase. The pressure to maintain morale and optimism despite hardships. Being on the go, trying to not really think about what has truly been lost can have severe effects. And the risk of burnout as reality set in. Reality, your actual feelings, more than just a broken house, what that house meant to you, what it meant to your family, in accordance with an event like Katrina, or losses, not being able to enter restaurants, little things about our way of life that have forever or for a very long time been altered. Those kinds of things are challenges that really need to be recognized and acknowledged very early on before the heroic phase burns somebody out. So now moving on to the honeymoon phase, a dramatic shift in emotion. Disaster assistance is readily available, community bonding occurs. Optimism exists that everything will return to normal quickly. As a result, numerous opportunities are available for providers and organizations to establish and build rapport with affected people and groups, and for them to build relationships with stakeholders. This phase may last a few weeks. So as the video suggests, needs and challenges of disaster. The honeymoon phase may not be as positive as the name may suggest. So this can be considered the crash point. Who? Disaster workers and the communities that they serve. When? When does this happen? This phase typically occurs after the initial response efforts begin to stabilize. So once everything begins to calm down. Why? The realization that challenges persist beyond the initial crisis, sustained pressure and stress start to drain and to resolve. So people start to realize, well, situations like Katrina, I fixed my house. but there's still issues. I don't feel happy, emotional, and just this stress starts to come out because even though the here and now was fixed, there is still trauma. So signs of a crash point: transition from optimism to fatigue and frustration, and the feeling of isolation and reality begin to set in. Moving on to the disillusion phase. The disillusion phase can be described as communities and individuals realize the limits of disaster assistance. Optimism turns to discouragement, and stress continues to take a toll. Negative reactions such as a physical exhaustion, such as substance use, begin to surface. The gap between need and assistance leads to feelings of abandonment. This phase can last months and even years, and it is extended by trigger events such as anniversaries of the disaster. So, right after the crash out point, during the disillusionment phase, people start to realize that it's going to take a long time to fix the problem. Because the problem isn't just physical, it is emotional, it is community, it is trauma, it is so many different things. There has to be emotional work to put in, and it's not as simple cut as rebuilding a home. It's fixing what is inside of your mind. It is what made you you. So during this phase, you do start to see coping mechanisms such as drug abuse, substance abuse, marital problems, isolation, domestic violence, and these are some of the things that can be seen that people use to cope. During this phase, fear, anger, and hopelessness emerge. When it comes to clinical conditions, some of the things that can be seen, brought out or brought upon by these disasters can be anxiety disorders, that's increased stress and hypervigilance, depression, feelings of sadness and hopelessness, and adjustment disorders, difficulty coping with ongoing crisis. Treatment options. There are a couple of treatment options for some of the disorders and during this phase, and some of them include psychotherapy. So this can include cognitive behavioral therapy, CBT, to help process emotions. Another one can simply be support groups, coming together as a community, encouraging peer support groups and sharing experiences. That may be a way to communicate and really find connections and know that you are not alone in realizing that healing is going to take longer than expected. And well-being initiatives, so resources such as those offered by the American Nurses Foundations. Conclusion. So I first would like to say that although these phases gave a time period, a typical time period, there are individuals or situations where individuals can go through these phases and stay there for a very, very long time, a short amount of time, or maybe skip a phase. There are a lot of situations where people stay in the disillusionment phase. It is very tragic. It is very hard to see that this can happen to people, but it highlights the importance of being a community and being there for these individuals in order to assist them to get past it or offer them the resources to do so. The next phase that would occur would be the reconstruction phase, and this is an overall feeling of recovery. And to summarize key points, there is the heroic phase where individuals attempt to fix what they can and reconstruct. It is often characterized by overworking themselves and low productivity to what is actually the issue. Secondly, honeymoon phase, where individuals are in a point where things are slowing down, but they're starting to realize that there will have to be a lot of work put in order to get out and recover. Then there is a crash out point that leads into the disillusionment, the feeling of hopelessness, the start of coping mechanisms depression, anxiety disorders. In this phase, there needs to be, in all phases, there needs to be a sense of community. In the last phase, reconstruction, in order to get there, there needs to be a sense of community all the way through. People, and as the video discussed, there are, in all phases, people find Christ, people find religion, people find spirituality. There are recognition of the people who are helping them being religious, being Christian. There are moments in the last phase, before reconstruction, where in disillusionment and hopelessness, people find Christ. And it is what removes them from the coping mechanisms and helps them move forward and understand and attempt and find groups like them in order to communicate and build a sense of community and build a sense of spirituality in order to understand why these things happen or try to cope with the idea that they did. That's why I would like to highlight the importance of preparedness plans and being prepared for when situations like this happen. Being aware of the phases to understand where you are in the moment when and if a situation like this were to occur to you, because it can happen to anybody. And finally, a call to action. And I would encourage everybody who is watching to engage in dialogues about their feelings and seek support when needed. And finally, in the next slide, I'm going to include my references, but I would just like to thank you so much for watching this video. I hope that it has been informative. I hope that you have found some substance in this. Thank you so much for watching, and you have a great day.